Welcome back to Health Talk. We have with us Dr. Vinayagam Senthil, who previously spoke to us about the importance of preventive health, what tests a person should take, and what a food a person should take, highlighting important rasam made by grandmothers as well. So welcome back, doctor. How about we speak now? We spoke of the liver, we spoke of the kidney. Can we talk about the heart now, doctor? How important is cardiac health, and what tests or what activities a person should follow for the same?
It's a very, very important question. And this I want to tell you that we have heard from our friends and relatives. I was just talking to him yesterday night and you could hear from someone, yesterday attended his marriage function. Yesterday I saw him in the park and he was playing with me. We are all together, walking together, and today he is not there. So we are getting this conversation and this news in the WhatsApp and in the social media and in discussion that a person was healthy yesterday, no symptoms, and today is suddenly collapsed. And that happens only in one disease, that is a cardiac disease. A sudden cardiac arrest, the patient may not live for the next minute. So we need to know how this happens. How suddenly can, the people ask, how suddenly the patient was good till last minute. The people say, he was talking to me for last 10 minutes, right now he is not there. So this kind of informations, this kind of discussions you might have heard from your circle. So he was a fit person. Previously an actor was there. He was doing a gym and he was fit enough. But how? He suddenly arrested, he collapsed and he was being rushed to the hospital, he was not able to be saved. So what's happening inside? What is that is making a person to collapse suddenly? So that is the cardiac. Heart is such a beautiful organ. From the day a mother conceives, from the womb, the heart starts beating. And it beats till the end the person lives. When the heart stops, the person dies. So what is that we need to understand is, heart is a beautiful organ that indicates when it has a problem. At times, there are situations it may not indicate because it's so well compensated. The heart is so well compensated, it will try to pump as long as it can. The situation where there is no absolute shot of blood, because every organ needs blood. Heart also needs blood to pump. There are three major vessels in the heart. One is the right coronary artery, the left coronary artery. The right coronary artery gives left anterior descending, left coronary artery gives left anterior descending, left circumflex, and the right coronary artery gives PDA. So these three major vessels, that is RCA, right coronary artery, LAD, left anterior descending, and LCX, circumflex. These three major vessels supplies the heart. The very important lifeline for the heart to function and pump. If suppose of the three, two is blocked and one still is there, still heart functions. Of all three shuts down, then heart's not able to function. Even that situation, find collaterals, try to function and help the person who's to live. But in all these three things gets blocked, then definitely the patient has a problem. Now you asked me a question, what parameters can indicate to me? I can tell you, a simple ECG that can be done within 5 minutes can make a huge lot of difference to give an insight. I will not say ECG can give you 100% of an insight, at least more than 90% of an insight, it can give what's happening inside. The electrical rhythm of the heart, what the ECG is called electrocardiogram, that gives what happens to the electrical activity of the heart. If the electrical activity of the heart is good, looking at the ECG, more than 90% of situations we can make sure that, okay, the heart is doing good. Any small variations, the heart electrical activity should also show variations. Thereby it can indicate, okay, something is going wrong. ST inversion, ST elevation. A lot of parameters are there, technical parameters are there, where these parameters could indicate that something is going wrong inside. If something is going wrong inside, then the next test, we need to advise the patient to go on to take an echocardiogram. That means like how we do an ultrasound in the scan, the function of the parts of the organ. That heart function can be seen by an echocardiography. So the echocardiography can tell us what is the contraction, where all the contraction, is the ejection fraction good, so is the heart functioning good. So these two will add up on to close to 95%. Still not 100%, still 95% we can make sure the heart is doing good or not. If it's not doing good, what is the problem it has so that it can be treated accordingly. In case by taking an ECG, in case taking an echocardiogram, these two parameters say something is abnormal. That means it can indicate, is it a rhythm abnormality, is it a beating abnormality, or it can tell you there's an infarction, hypokinesia. That means this part of the heart is not working well. that then it indicates is something to do with the rhythm or something to do with the blood supply. So is it an electrical problem or a mechanical problem? So based on that, suppose it's going to be a blood supply, then we can advise him that to go and do a angiogram to see the blood flow of the heart. When you do an angiogram, that is close to 100% to see what is the blood flow to the heart of the three major vessels of right coronary artery, left anterior descending and circumflex. Is all the three blood vessels supplying the heart is doing good and all the caliber is good, there is no block in that, then it's too good to say you don't have a mechanical issue of the heart. The blood supply of the heart is good. Suppose have a rhythm abnormality, you can treat with medicines or we can treat with pacemakers. Then that goes from further that to evaluate the patient to know what he wants. But having said that, in case there is a block in any of the vessels and the block is more than 50 to 60%, that means the flow of blood to the heart and the myocardium is going to be jeopardized, then the cardiologist can suggest you to do a stent. If suppose one vessel is blocked or two vessels is blocked, then a stent can be advised. If suppose all the three blood vessels are blocked and the stenting may not be possible, at that particular point of time, you can advise to go to a cardiothoracic surgeon and get a bypass done. Now, what happens is why people don't get all this tests done is because, one, they are lazy, because they want to buy a car. The car might be of 10 to 12 lakhs of worth and they want to buy a house of lakhs and crores of money. But to invest on oneself health, there is a laziness. There is a mental laziness. I mean, what if, I'll do later, I'll do next time. So this laziness, how much of investment that you do for materials around us, you need to invest on yourself to know what's happening inside you. Because this cost of this ECG or echo, ECG is just 200 rupees is the cost. It's not about the cost, it's to know for yourself what's happening inside. And an echocardiogram may not be for more than 2,000 rupees. So within 2,000 to 2,500 rupees, you have a basic heart checkup that to know what's inside. Then why you need to give surprises to your family? The biggest surprises that you can give a family is not being. Why? If some blood parameters or some, investigation parameters can tell you what's happening inside, why at all you need to give surprises to your family and your friends? Better looking into the video. Yes, I'm not pushing you to do an investigation here. I'm educating you. It's nothing wrong about thinking about it. Yes, in case you want to have all your investment, you have to be there to enjoy it. Understand that. Even it's not that you being to enjoy it, you are the most important person for your family. Understand that. Yes, take care of your health. Give priority to your health. Give preventive health checkup to your health so that you will be a person with them. It is your family. You are the most important person for your family. So be with them. For you to be with them, you need to take care of yourself as well. Taking care of yourself is not a sacrifice that you do for family. That means you slog and you work and day, and that you compromise on your health is no way that you're doing good to yourself and to your family as well. Understand? So the message is very clear.
It is always nice to hear from a passionate doctor. So thank you for that. So you spoke about three tests, electrocardiogram, an echo, and angiogram. So, and you spoke the costs also, which not many know. So how frequently and what age should a person start taking these tests?
So I strongly recommend any person the age of 40 and above, kindly do your master health checkup. In most of the master health checkup around you, you have an ECG or an echo or an ultrasound, an X-ray, all this as a part of a package. Kindly do it along with the basic blood test. It's available. You step out of your home and 100 meters parameter, there are plenty of good labs and hospitals available for you. Kindly go ahead and do it and see what's happening inside. Just have one consultation with a physician. He will tell you what's happening inside. If everything is good, then go all out and pump in and go work more and to earn more and to make yourself and your family happy. But for that, you need to be healthy first. So this is what I recommend to people above 40. If suppose there is any ailment in the family, that means a father and mother has suffered from cardiac disease, I recommend you to do as early as almost 25 years to start with to the checkup and just keep checking every 5 years these parameters so that because there's a family history, there are chances that the people in the family, elders in the family had, there are chances that it could be genetically or familially could be transmitted so that you can have the check start. I'm not saying that if a father and mother has, a person should have. I'm not saying that. It's better to check if something is there. If something is there, heart disease is a preventable disease. Heart disease, if not for congenital, if not because of a lifestyle and it's also because of an acquired, And it is completely preventable and curable, provided you pick it up at the right time.
So you spoke about preventive health again. It goes back to our previous episode as well. So now, doctor, with respect to cardiac health, you spoke about both the mechanical side and the electrical side. We all know the brain is an electrical organ. So how can the brain and neuro aspects have an impact on cardiac health, doctor?
See, all the command center. Brain is the command center for the heart to pump. How the heart to pump fast, how to pump slow. See, suppose, and a happy news is there. Then the heart functions good. When an unexpected news is there, the heart pumps fast. When there's a fright mechanism. And a sudden shock, then heart pumps fast. It starts. So all this has something to do with the neuroelectrical phenomenon from the brain. Now try to understand one important parameter, the hypertension. The people with hypertension, most of the people don't even check the BP. Leave alone the ECG, leave alone the echocardiogram or angio. Try not to see about a BP. I mean, it's available in your next clinic. Or there are a lot of electrical self equipment where you can check for yourself. I mean, even it is in a watch. Today in a watch, in the gadget, you can check your heart rate, you can check your saturation, and certain watches are available where you can check the blood pressure also. So it's all available as a common open source. So look at your BP. Is your BP of 120/80? I mean, I have seen one person came to me with a headache. When I saw his BP was, say, 210/150. It is double what is required and supposed to be. Because he said, sir, so far I have never checked my BP. So far I was good. It's okay. Your body has compensated for you to be good. That's how the body responds to us. That's the body respects us. That's how it is. Doesn't mean that we shouldn't care it. So, and I told him, no, your BPs are very high. That's the reason why you have an headache. So, you need to bring down your BP. So, he was on antihypertensive after that. When you go back to his lipid profile, then all this cholesterol and all this were very high. I say, bring down the cholesterol. You do a lifestyle. Don't take fatty foods. Don't take deep fried foods. If you want to take a meat, you better boil it and take it. And you walk every day for an hour. Every day you take a lot of fruits and vegetables. Yes, do meditation. Because today, meditation and yoga has a scientifically proven evidence to maintain and bring down the blood pressure and diabetes. So, because the stretches, the calm mind and mindfulness has a direct impact on the brain and the heart. So, the hypertension and diabetes or the parameters that could even affect the blood vessels of the brain. And if constantly it is pumped up, there are chances that the blood vessels in the brain can open up around rupture, the patient has a bleed. When the patient has a bleed, they go to coma. Or there are situations where what parameters that blocks the heart? The same parameters and the lipid parameters could block the blood vessel of the brain. If it blocks, the blood will not go to the brain. The brain cannot function. Brain needs glucose. For the blood has to carry the glucose to the brain for the brain to function. If it is not functioning, then the patient finds himself in a stroke. So if there is a blockade, blood does not go, brain doesn't function, stroke. Or the blood pressure is too high, it goes and ruptures the blood vessel, that bleeds in the brain. Again, a form of a stroke. Yes? So, what are the parameters affecting the heart and the rest of the body? The same parameters affect the brain.
Okay.
Once a brain goes comatose and rest of the organ functions, what is the use? And he becomes a kind of a coma person, he can't understand anything and the rest, he lives for what? So, very, very important. So, the brain, the heart and the brain, all this has to be taken care because once you could look into it and take care of it, yes, you can have a beautiful life for yourself and your family and you can enjoy all that you have with you.
So, okay, doctor. So, we spoke a lot about cardiac health. We went into neuro. So, you spoke about lipid. So, that seems like a common thread between both neuro and cardio. So, how would a person control the lipid intake, Father?
See, the lipid profile, you need to have this in your mind. When a person is, the general assumption is this. Whenever the person is fat, they think the person has more cholesterol. It is not that way. He can have more cholesterol, less cholesterol. Right? Understand, if a person is lean, doesn't mean that he does not have less cholesterol. It's nothing to do with the blood. What is that you see in the lipid in the body is nothing to do with the blood. The person who is obese can have a normal cholesterol. I have seen patients and even literature says that. Even a person looks very thin or lean or fit, whatever it might be, and it doesn't mean that he will have a normal cholesterol or less cholesterol. He can have, but it doesn't mean that way. Depending on the body weight and the appearance, it does not correlate with the blood cholesterol levels and triglyceride levels. So, in case you want to know exactly and appropriate, it is better to do a fasting lipid profile. That means, without taking food in the morning, take a blood and they'll give you the exact total cholesterol levels, HDL, LDL and non-HDL, and they'll give lipoprotein levels. All this will, and also the ratios about the LDL and total cholesterol and HDL and LDL level. Those the parameters will tell us if the risk, a cardiac risk is there or not. And this lipidemia and hyperlipidemia and hypertriglyceridemia, that means all these triglycerides and total cholesterol all are high, then it's a marker that you need to step in and to take care of your kind of a cholesterol. Either you can alter by taking the fatty foods inside deep fried foods, taking that you can reduce, or in case it's not possible, you want to have a good control of it, then you can have anti-cholesterol drugs, like they are called statins and fibrates, and that can lower down the cholesterol and triglycerides. And also you need to look into the HDL level, little jumping into more because it's a good cholesterol, and there are food parameters which can help you to get your HDL level more, and we can talk about that in the lifestyle modifications next. So, looking on to these lipid profiles will help you to assess what is the atherosclerosis, and that can happen. It can plug into the blood vessels, either to the heart or the general arteries, the peripheral arteries, or in the blood supplying the brain. You can have an idea. Based on that, you can control it, and you can have a good vascular health, and that in turn a cardiac, neuro and general all vascular health as a whole.
So thank you, doctor, for talking about cardiac health, neuro health and preventive health. I think I can conclude by saying that appearances are deceiving when it comes to cardiac health. A obese person can always be fit, and a thin person can not be fit also. So I think it goes to say that a person has to take health checkups as you suggested, following your suggestions and recommendations. So thank you, doctor. I think we'll continue with life modifications next.
Yes.
That'll be a good topic.
Yeah.